Welcome back, class. So, we've been talking about epidemiology, and now we're going to be talking about how we classify infectious diseases. We aren't classifying the organisms here, we're just classifying diseases by different characteristics that that disease has. One way is by the signs and symptoms, and these two words actually have very different definitions to them. So, a symptom is something that when your patient is sick, they definitely know they have it, but you as a provider can't tell. So, something like your patient has a headache. They definitely feel that headache, but you can't look at them and say that. Maybe they feel their leg is hurting or something. They know it feels like that, but you can't. You can't see that just by looking at them. A sign is something that you can measure or you can observe. So something like you can look at them and see, oh, I see you have a lesion. I see your foot is swollen. I can measure your fever. I can actually stop and measure that your leg is paralyzed. So symptoms, your patient is going to have to tell you. You can't just see. Signs are something that even if your patient isn't able to communicate with you, you can sit there and investigate and observe a sign. And then a syndrome is going to be a specific signs and symptoms that accompany a disease. So if we are thinking of COVID-19, just because it's so recently in our minds, what would be some symptoms of that? What would be some signs of that? So I would say a cough. Would a cough be a sign or a symptom? What would be a pain, that feeling of pain and malaise? So it would be a symptom. A fever, being difficulty breathing, that would be signs. So that would altogether, all of those signs and symptoms would be the syndrome for COVID-19. Another way we can classify diseases is how they are spread. If something is able to spread from one host to another, it's a communicable disease. Something like chickenpox, measles, herpes, tuberculosis. These are things that can be communicable between patients. So if you have a patient who has herpes, anyone that they sleep with is able to contract herpes. If you have a patient that has tuberculosis, people that are around them, as that patient with tuberculosis coughs or sneezes or spits, that can be spread to people around them. A lot of cities actually, especially if they're at least a couple hundred years old, a lot of cities will have laws against spitting in public because that was a way that tuberculosis was spread from one patient to another. A contagious disease is a type of communicable disease that is easily spread. So chickenpox and measles. If, when I was a kid, if someone came to school with chickenpox, nobody was vaccinated against chickenpox yet. It didn't exist, but everyone in the class by the end of the day probably was going to have been exposed to chickenpox and would be probably developing symptoms of chickenpox by the end of the week. Measles is one of those that is super contagious. So measles is a disease that was almost eradicated. And maybe 10 or 15 years ago, there was a case of someone with measles who went to Disneyland in California. A lot of what you do at Disneyland is wait in lines. And even though a lot of those lines are outside, that one kid with measles was able to spread measles to a lot of unvaccinated children who are also visiting the park. A non-communicable disease is a disease that is not transmitted from one host to another. These might be caused by microbes that reside outside the body or from your normal microbes that can occasionally cause disease. So something like Clostridium tetani, tetanus. If you step on a rusty nail, that bacteria can germinate and grow in that anaerobic deep wound. But if you have tetanus, you're not likely to spread it to something else. Food poisoning. Maybe you ate something that was contaminated with E. coli or with staphylococcus, and now you're sick with that. But the people around you aren't going to get sick just from being around you. Or if you have a UTI from your normal microbiome that got into your bladder and now you have a UTI. That would be a type of a non-communicable disease. Another way is how the disease occurs. And so I'm going to be honest here. These are two terms that I cannot keep straight in my mind. but at the same time, I have to teach you them. So you get to memorize these terms, and I will read them off this slide to you and not keep them straight any other time. Incidence is how many people have contracted the disease in a specific amount of time. So if you remember back when COVID was on the news every day, they would be like, we had this many new cases. We had 20 new cases today. We had 4 new cases today. It's a good way to study how these diseases are spreading. Prevalence is how many people have the disease right now, regardless of when they first appeared. So instead of being this many new cases of COVID today, it was we have this many sick people right now. People included in prevalence could be people who got sick today, who tested positive today. It could be people who tested positive 2 weeks ago but are still sick. It could be people who tested positive 6 months ago but now are dealing with long COVID and are still in the hospital on a ventilator. All of that is included in prevalence. So prevalence is more of an impact on, what kind of impact are we seeing on the healthcare community, but not necessarily how many new cases are popping up right now. Then a sporadic disease is a disease that just occasionally pops up. So something like typhoid fever or salmonella, you might suddenly just see a bunch of cases of salmonella, which is a food poisoning, just pop up occasionally. So here we are seeing how many cases are happening every year. We have this many cases each year. And then this year we have a big jump, mainly because they expanded the definition of what counted as a positive case. So if we're looking at how many people are sick each year, would this be studying incidence or prevalence? Another way, and these are terms that if you took this class 2018, you probably wouldn't have been comfortable with those diseases. But at this point, we've already heard these a lot in the news, so you probably already know these words. An endemic disease is a disease that is constantly present in a population, just kind of there in the background, something like the common cold. It's not likely to be a big strain on the healthcare resources because it just kind of always sits there kind of at a background level. An epidemic is something that a bunch of people pop up sick with it in a short amount of time. An epidemic is more likely to be a strain on the healthcare community because a week ago we had nobody sick with it, and now today we have a lot of people sick with it. So suddenly you have a lot of people seeking care that maybe that infrastructure isn't in place. Influenza, STD, suddenly you can have a big jump in cases. A pandemic disease is a worldwide epidemic that has, that epidemic, instead of being local, is now around the world. The rate at which a disease is going to spread will depend on the immunity of a population. If everyone in a population is immune, it's going to be harder for that pathogen to find a person to create an infection in. But if most of the population is not immune, then you're going to have a lot of people that can get sick with it. So back talking about COVID again, if you remember when COVID very first came to the United States in early 2020, nobody had been vaccinated, nobody had been sick, so nobody had immunity to this disease. And a lot of people spread. It spread very quickly. At this point, people have been vaccinated, people have developed natural immunity from being sick with it, so we don't have as many cases of it. We still have some COVID-19 going around, but we don't have a huge jump in cases every day. When we're talking about most of the population being immune to something, we have something called herd immunity. So there are some people who cannot be vaccinated. Maybe they're undergoing chemotherapy, maybe they are too young or too old, maybe they have a specific autoimmune disease that they cannot tolerate vaccines. So they're going to be reliant on the people around them staying healthy. So if you personally are not able to be vaccinated, but all the people you interact with are vaccinated, it's unlikely that you're going to be able to develop a case of the disease, because who's going to make you sick? You're surrounded by people who are immune, so you stay immune. And that is what herd immunity is. When those most vulnerable part of our population is protected because the rest of the population has stepped up and gotten vaccinated, so that those most vulnerable people don't have to worry about being sick. For most diseases, herd immunity is going to require at least 85%, even 95% immunity for people to not come in contact with someone carrying the disease. Another way to classify is by how long the disease lasts. So if you think, oh, that's just a cute little thing, just so cute and little, an acute disease is something that lasts just a little bit of time. Sometimes they're going to develop rapidly, you'll get sick and then recover. Something like influenza. It doesn't necessarily feel like it's a short time while you're in the throes of being sick, but a couple weeks later, you're going to be done. You're not going to be sick for the rest of your life. A chronic disease is a disease that develops more slowly and is more likely to continue or recur for a long period of time or even the rest of your life. Something like mononucleosis takes a long time. Hepatitis B, tuberculosis. A lot of chronic diseases are not necessarily microbial, but something that can last for a long time, like an autoimmune disease. A subacute is not quite short enough to classify as acute, but not quite long enough to classify as chronic. It might last a month or two, longer than acute, but shorter than chronic. So subacute is in the middle. Something like sclerosing panencephalitis, that encephalitis here, part of it, this is going to be a rare brain disease. And then a latent disease, a disease that the patient will get sick with it, and then that disease goes inactive. And during that inactive time, they're not showing signs and symptoms, they're not spreading the disease, but that causative agent is still in their body and it can pop up again. So something like chickenpox, we already mentioned. I got chickenpox when I was 10 years old. That virus still is in my nerve cells. It still is in my body. And when I'm older, it could pop out as a case of shingles. A cold sore or genital warts, if you have a patient with those, that virus lives in their body forever. For the rest of their life, it'll be in their nerve cells. And maybe they get stressed out. Maybe they're on their period. They're just worried about final exams. And that virus can pop out and recur as more cold sores or as genital warts popping out again. Then, how much of the body is involved? How much of that host body is involved in the disease? A local infection is when the pathogens are isolated to a small area. It's like a staph infection, a small wound that gets infected. A systemic infection is an infection throughout the body. So something like chickenpox that is all over the body. Then a focal infection is something that starts out as a local infection and then spreads, becomes systemic. Sepsis is when a microbe is spreading through the body and it results in toxic inflammation. Especially involves bacteria and their toxins that spread from a focus throughout the body. Bacteremia is when bacteria are in the blood. Septicemia is when bacteria are growing in the blood. Septicemia is also sometimes referred to as blood poisoning. A few more vocabulary terms. Toxemia is toxins in the blood. Viremia is viruses in the blood. Then, sometimes one infection can lead to another one. A primary infection is going to be that acute infection that causes the initial infection, and a secondary infection would be an opportunistic infection after that primary infection. So primary infection might be chickenpox, and then a secondary infection would be pneumonia developing after that. Then a subclinical disease would be when a patient is infected, but there's no signs of infection. There's no signs or symptoms. So in my family, my husband is a nurse practitioner. So he very quickly brought home COVID to us. We had it early in 2020. And all of us tested positive, but only my husband and I had signs and symptoms of it. My son, meanwhile, had a positive test, but he was still running around, playing, riding his bike, acting like a kid. He had a subclinical case of COVID where he had no noticeable signs or symptoms. Okay, so at this point, can you tell me, is food poisoning a communicable disease? What is the difference between a prevalence of a disease and incidence of a disease? And provide 2 examples of an acute infection and 2 examples of chronic diseases. Okay, I will see you back in a little bit. Bye.